4 months now, government and health authorities across the world have been trying to answer these two questions. How can we slow down the spread of new coronavirus? And how can we best protect those in society that are at high risk of getting sick from it? The answer are things we've become all too familiar with: social isolation, social distancing, lockdown, and face mask. But then there's another protection strategy in discussion, although its toll on humanity would be almost unthinkable.
It's called herd immunity.
Herd immunity.
Some countries are focusing on the best ways to reach what's being called herd immunity.
We call that herd immunity.
So, what is herd immunity and what does it have to do with containing the spread of COVID-19?
Yeah, herd immunity is the point when enough members of the population have their own immunity that the infection doesn't spread rapidly, because most of the people it tries to infect are already immune, so they don't get ill, they don't then pass the infection on.
If no one in the population is immune to an infectious disease, then everyone is susceptible to it. The disease can quickly be transmitted from one person to another. But if there are people who have acquired immunity to a disease either by vaccination or by contracting the disease before, they act as a shield between the disease and people who haven't yet been exposed to it, and who are not yet immune. For herd immunity to a disease to be attained, a certain proportion of the population has to be immune to that disease. That proportion is determined by how quickly the disease can spread. Scientists use something called the basic reproduction number, or R0, to estimate how quickly a disease is likely to spread among a susceptible population. This number tells us how many people one infected person is likely to spread infection to. That number is 2. It means that one infected person infects 2 others on average. In this case, at least half of the population needs to be immune to eventually stop the disease from spreading to the whole population. The percentage of people that need to be immune for the society to reach herd immunity is called the herd immunity threshold. And this threshold varies from disease to disease. Take measles for example. It's a highly infectious disease. About 95% of the population needs to be vaccinated for herd immunity. One positive effect of herd immunity is that it can lead to the eradication of a disease 40 years ago. Smallpox was eliminated globally because so many people had become immunized that the disease stopped spreading and died out. According to health experts, it can be important for a large portion of a population to become immune to a new infection disease, because that will keep the disease from spreading to those who can't be immunized, like elderly people, newborns, and people with vulnerable immune systems. Let's get back to herd immunity when it comes to COVID-19. There's no vaccine yet, so for herd immunity to exist, enough people would have to catch the new coronavirus first. Well, it all goes back again to the basic reproduction number. Remember, that was how many people one infected person infects on average. And this is where things get tricky, because our data on the new coronavirus is still very incomplete. Different studies place the basic reproduction number of COVID-19 between 2.4 and 3.3. And to make a calculation easy, let's take the number 3. So I'm assuming that one infected person spreads the disease to 3 other people. And because of here in Germany, let's see what that will mean for Germany. About a basic reproduction number of 3 means about 66% of the population would need to contract coronavirus and then this way become immune. Now, Germany has a population of 83 million people. 66% of that means 55 million people in Germany who would have to get COVID-19 for the country to reach herd immunity. So, should the government just let it spread? After all, the majority of cases are still believed to be mild, meaning patients don't need to be treated at hospital. Despite that, the road to achieving herd immunity would likely still be immensely painful.
The first and most obvious problem is to get that you have a lot of very sick people all at the same time, many of whom are going to die, and your death rates for a period of during the peak of that would be enormous and is unbearable to think of, really.
And epidemiologists have tried to project how many people in Germany could die if the country were to achieve herd immunity. The numbers range between hundreds of thousands to the millions. Making an estimate is challenging because there are so many unknowns.
First of all, because we don't know how the immunity actually evolves after infection with coronavirus, how long it persists, and how effective it is. And until we don't know those factors, we cannot really do any calculations on that respect.
Plus, talk about allowing millions to contract the disease brings us back to a familiar topic, that fears that doing so would overwhelm almost any national health system, including an advanced one and one that is very well funded like the one in Germany. Some European countries initially appeared to have opted for the path of herd immunity. Instead of putting the entire population into lockdown, the idea was to isolate high-risk groups, including the elderly and the people with a weaker immune system, and hope that the majority of the population will be infected and become immune.
It's not possible to stop everybody getting it, and it's also actually not desirable because you want some immunity in the population. We need to have immunity to protect ourselves from this in the future.
There was a change in course of 4 days after this statement, and after new data suggested that thousands could soon die if the government didn't step up efforts to slow down the virus. British Prime Minister Boris Johnson announced that his country was going to introduce restrictive measures after all.
We need people to start working from home where they possibly can, and you should avoid pubs, clubs, theatres and other such social venues.
And health experts are putting all the effort into slowing down the spread of COVID-19 until a vaccine is found. Experts believe that it may take up to 1.5 years for such a vaccine to come to the market, and even that won't be the end of it.
I do think that we will get a decent vaccine, but it won't necessarily last for a long time, and certainly won't last for our life. And even if we do get a good vaccine, it may well be that, like influenza, particularly at-risk people would need to be vaccinated every year, possibly for several years to come, actually.
To achieve herd immunity against COVID-19, it seems as though the process could take quite a while. In the meantime, that leaves government facing a very difficult question. How can they allow other parts of life to get back to normal without risking another spike in infections? Epidemiologists say protecting those with vulnerable immune systems should be one part of the strategy.
The other part is to make sure that treatment capacity is optimized, to make sure that the contact follow-up of patients that have been identified is made as rapidly and as effectively as possible, that testing capacity is available immediately for those who need, and by that I mean the prioritization of testing patients and medical staff.
The fight against COVID-19 is likely to be a long one. Here at home, Riski Pratama has warned that this is only the beginning of the pandemic and that we will have to live with this virus for a very long time.